It has been a fortnight since the World Health Organization released guidelines for countries to start using the new injectable pre-exposure prophylaxis PrEP drug for HIV called cabotegravir, an intramuscular injectable and long-acting form of PrEP. The first two injections are administered 4 weeks apart, followed by administering an injection every after 8 weeks. On Health Tonight, Henry MU-JHU delves into understanding how this injection works and the preparedness of Uganda in making this vaccine accessible to the masses.
In Uganda, the first cases of HIV were recorded in Rakai district in the early 1980s. Several interventions have over the years been launched to contain the spread of the disease. And after being tested in 2 randomized and controlled studies where Uganda was involved, cabotegravir has been found to be more effective than oral PrEP, with a 79% increased reduction in the HIV risk.
All along we have been having the oral PrEP, which we call Truvada, for the prevention of HIV, which was approved by WHO in 2016. Good enough, this research found that actually cabotegravir, the long-acting injectable ARV, could actually protect women. This research was among women, could protect women who are HIV negative but at high risk of HIV infection.
According to the Director General of Uganda AIDS Commission, Dr. Nelson Musoba, to achieve the United Nations prevention goals, Uganda must push for rapid and equitable access to all effective prevention tools, including long-acting PrEP.
It will be used in combination with already what we have, but it's a welcome technology, and we are looking, to engaging, and I'm sure the Minister of Health will take this up and we add it to the package that we already have so that our people have a range of options.
Despite African countries, Uganda inclusive, struggling to avail oral PrEP for public use, the Minister of Health says they are now in preparations to make cabotegravir accessible to all that need it.
So we are bringing it on board. It is in our new guidelines, and we shall start it in a small scale, look at how it is performing, as I said, in our implementation science mode. And once we see that it's working well, we have learned the acceptability, the feasibility, all the issues of cost, we then expand on the numbers.
According to researchers, long-acting cabotegravir is a safe and highly effective HIV prevention tool expected to accelerate the country's effort in the fight against HIV.
They found that actually both drugs work, but cabotegravir was superior to the existing oral PrEP, the Truvada.
The guidelines on the use of cabotegravir were launched ahead of the annual International AIDS Conference, and they come just a day after UNAIDS released a world report showing that in 2021, 1.5 million people contracted the HIV virus globally. This new intervention comes to give a hand to the so many approaches that have been in place in the fight against HIV/AIDS. Victoria Bagaya, Henry MU-JHU, NBS, Live at 9.